All right, so it's 7 o'clock. There's a little bit of a delay here, so I'm going to go ahead and get started here. I'm going to turn the screen around. I tried to do this. Whoops, I need to get to the beginning here. I tried to figure out how to do this. Just let the share screen, but I can't do it and flip the screen around. So we get the iPhone quality. So let's go ahead and get started here. So title's still going to be the same. COVID-19, let's work together and stay apart. It's Dr. Malcolm's not with me here tonight. It's just going to be me tonight. So what are we talking about tonight? I wasn't going to do a presentation this week, but then when Governor Kemp decided to open up our state and undo the home quarantine, I was asked by a number of people what my thoughts on that were, and I kind of didn't want to leave people hanging, and certainly I have some thoughts on that. But, unfortunately, I am not going to get political. This is not going to turn into a political discussion here, but I want to give everybody the points that are just things that we need to do to be sensible now that our state's opened up. Now, President Trump just came on TV here in the last hour. I don't know if any of y'all listened to him, and he openly disagreed with Governor Kemp's decision to open up the state, specifically calling out the need to open up tattoo parlors, beauty shops, stating that safety must come first. So there's clearly disagreement, and these are two Republicans. And again, this is not a Republican-Democrat thing here, but Governor Kemp decided to open the state up, and Trump is openly stating disagreement about that. About the timing of that. So again, I just want to give a quick disclaimer. The comments and observations I make are these of myself. That I'm not representing a hospital. I'm not representing the physician group that I work for. But it does come from just input that I've had from just a number of reading, a number of patients that I've seen, articles written, discussions on a national level, and so on about COVID. And hopefully I can give you guys a little insight on that. So Governor Kemp decides to open up Georgia with an aggressive course. Now, I'm going to talk about that here in a little bit. I mean, I don't think he's just opened the state up. I think there's a number of restrictions, and we can talk about the things that he's done. I'm not saying that I completely disagree with what he's done. I think he's laid out what might actually be a fairly reasonable plan, and I will explain my thinking about that here in a little bit. So let's just kind of track and kind of go back with where COVID's kind of gone worldwide here. So that back in March 10th, about 6 weeks ago, we were at 114 worldwide cases, and we're now up to 2.5 million cases. We've had 4,000 deaths 6 weeks ago, and we're now up to about 178,000 deaths. And remember this little curve down here in the corner. The cases are still increasing. They're going up, up, up. But you see this what we call, this is the logarithmic curve. And whenever that curve kind of starts bending like this, we know the acceleration or the rate of growth of cases is tapering off or even decreasing. At this point, there are more cases, but the rate of increase is decreasing. So when you see that kind of line bending down like that, that's a very good sign. And we've talked about that before. This is the United States. Back on March 4th, when that other slide I just showed you was shot, there, the total confirmed cases in the U.S. was like, it was like 100 cases. Very few cases at that point, and we had very few deaths. So these numbers start on March 30th. We had 143,000 cases, and in the last, it's really less than a month here. We're about maybe 3.5 weeks. We've gone up to 800,000 cases. Deaths were 2,000 at the end of March, and we're now up to 45,000. And again, we see the same line of increasing cases, but we see this bending of cases where the number of acceleration is definitely tailing down in the United States. So this is the from the IHME group, where this was back on March 28th. And at that time, again, there's about 2,000 deaths in the United States, and we estimated 81,000 deaths. And there was a range, 40 to 60,000. There was a range here. And I hear people say, all the early things were wrong. They were way off and blah, blah, blah. And this is what, it was always 40 to 160,000. I mean, when you're at 2,000 deaths, it's very hard to accurately predict the number that you're going to get to. And we're definitely in this range now. April 9th, about 12 days later, the numbers or the estimate came down from 81,000 to about 61,000. At that time, we had 16,000 deaths, and the range was in the 35 to 150, kind of tightening that range up a little bit. And then as of the 21st, as of yesterday, we're at 43,000 deaths in the projected range that we expected, and we're estimating about 60,000 with this range still, well, the range 38, well, we're already over that, but up to 140,000. So nationwide, again, we see this bending of the acceleration curves of the number of cases of COVID. So this is, again, the cases, this is the number of cases here. This is the number of deaths over here. So all the major cities, New York, Boston, Los Angeles, Atlanta, here's Atlanta in there, Seattle, from the time that they first had 200 cases is when you start checking the number. And then all of these, instead of doubling every 2 days like it was, New York City's probably over here, at every 4 days or something like that. And so when the curve again starts bending like this, we know that we're making a dent and we're making improvement on the acceleration of this disease. And then same thing with the deaths over here. This is Georgia. April 2nd, we anticipated about 3,200 deaths in Georgia. Just under 3 weeks later, the numbers are projected down to 1,900 in Georgia. So that's great. We're doing a great job. So as of today, we have 818 deaths in Georgia, 20,000 cases. Okay, so we're going to talk about Governor Kemp. He decided to open up Georgia a couple days ago, made the announcement on the 20th that we're going to gradually open up Georgia. Now, why did he decide to do this? I mean, the safety, let's keep everybody at home. Well, first of all, I mean, we all feel a little cooped up, but probably the bigger reason is there's a very big economic impact of keeping people at home. The estimated cost to Georgia in sales tax alone is $1.27 billion in the state and local level. Income tax this year is estimated, just right now, they're estimating at least a $1 billion loss in state income tax. Next year, just as a result of what's happened this year, they think it's going to be $3 billion next year. University of Georgia estimates $350 million in loss. And so let's kind of put that in perspective a little bit. Georgia's revenue is $45 billion. So if you kind of add these numbers up here, that's about 5%. It's about 5% of our total revenue if you add all the income tax and the sales tax together, and then the UGA, and there's all these other losses. I mean, people are losing jobs and so on. So it's a lot bigger than just this, but this is the actual cost to Georgia. Now, what do the federal numbers look like? They're much worse on the federal level if we look there. So the CARES Act, which was the Corona Aid, Relief, and Economic Security Act that we needed to put in place to inject money into the small business and big corporations and so on, just to kind of keep this country moving. The stimulus package was $2 trillion. $2 trillion that was passed. And kind of the breakdown is over here of how that money was distributed. And then yesterday and today, and it's probably going to get passed here very soon, there's a second round of PPP money, which is part of this, part of the CARES Act, because not everybody got their money. There's another $483 billion. So in total, that's $2.84 trillion that we've now had to inject into the economy. Partly, I mean, a lot of this was coronavirus, but a lot of it is strictly related to us shutting our country down. So let's kind of put this into perspective. What does that money mean? So if any of y'all have seen this is the U.S. debt clock, and you can go to usdebtclock.org and take a look. But our national debt right now is actually up around 25. This is actually from February 2020, and I wanted to make a point by just going back 2 months and showing you what it looked like 2 months ago and how much it changed just from the CARES Act of what's been put in place so far. Every year, here is the amount of tax revenue we take. These are good numbers to know anyway. Tax revenue that the government, the U.S. government takes in every year is about $3.5 trillion. Our federal spending every year is about $4.5 trillion. So right now, our government loses $1 trillion every year. And we just spent 2.5 times that on the CARES Act. And our national debt went from 23.2. You'd think it would go up more than this, but this is the debt clock today. It's gone up about 1.2, and a lot of that is that not all this money has been dispersed yet. But look at this: our federal spending 4.5. That was kind of estimated earlier this year. That's a annualized number, is up to 5.8. And of course, our revenue is now adjusted down from what's happened. So we are now, 2.4 trillion in debt this year, and not all of this money up here has been dispersed. So the point is, there's a very real economic impact of what's going on here, and if you go to the actual U.S. debt clock, you can kind of see it just run like that. So, any rate, big financial impact. Governor Kemp decides to open up Georgia. So I want to start with the slide that I showed toward the end of last time and kind of go through what I thought would be the end game. So the end game, there's certain things that need to be put in place to open up our country or our state. Or these are things, and it's not just me. There's a number of medical experts saying these are the things that need to happen to open things up. And not everything is going to be 100%, right? We can't be 100% squelch this thing to open everything up, because that just doesn't make sense. There's going to be a balance. There's going to be a point where we say, you know what, it makes more sense to do it at the point we're at. And I think we're pretty close to that point, frankly. And let's kind of just walk through some of those points. The end game for right now, to let people out, we need to continue physical distancing. There's no question about that. We cannot go out tomorrow and start having, watching football games and baseball games and spreading this thing around quickly. We need to do this slowly. And physical distancing is a way to introduce things slowly. We know that getting people out, and when people leave their house, and we are no longer doing what we're doing today on Friday or Monday, and people are going to go to the tattoo parlor or whatever, we know that this is going to allow coronavirus to spread faster than it otherwise would. I mean, there's no doubt about that. So if we can do physical distancing to help slow that, we should definitely do that. Secondly, okay, you know what? I'm going to go through the rest of this in a second. So we need to continue physical distancing. And frankly, this was part of Governor Kemp's plan. This is Governor Kemp's plan right here. We're going to open gyms, fitness centers, bowling alleys, body art studios, and barbers, and and so on. You can see the list right here. But he made a very clear point that we are going to follow social distancing guidelines. Businesses that are reopening, they face restrictions, including social distancing and regular sanitation. Businesses that allow more than 10 people at a single location must require 6-foot distance. So again, we're not going to open up restaurants and start, seating people right next to each other. We are going to have to do a 6-foot distance. And if that includes all the things up here, cosmetologists, barbers, and so on and so forth. And it's not just this. I mean, there's another number of other things. They have to screen workers who exhibit signs of symptoms of illness. They are not going to be able to come to work. Enhancing sanitation of the workplace. And then there's implementation of teleworking for possible workers. And there's a lot of here about, look, if you can work from home, you need to continue to work at home. You want to do meetings and conferences virtually, so on and so forth. And then there was another, whole list of things over here. So this plan is not opening up Georgia and having people just kind of freely pass things around. Clearly going to happen more so than right now, but there's a number of kind of safeguards that he did put in place. I want to thank one of the viewers here for an article they sent me in Sweden. And it was interesting because Sweden is a little bit different than Norway and Denmark and some of the other places up there, in that they never really shut the country down. It was kind of more of a voluntary type situation. So Sweden emphasized personal responsibility rather than enforcing a lockdown. And what did they find? That there were far more deaths in Sweden than in Denmark, Norway, and Finland, where they did have such lockdowns. Now, there's a little problem with Sweden that we'll get to in a second, but I'm going to make a point here about what we need to be doing here, and we need to not be doing what Sweden did. They left bars, restaurants, they even left schools open and allowing public gatherings up to 50 people. What they found was that the poorer neighborhoods tended to do far worse than wealthier ones. So the wealthy tended to have some idea, likely, about what they should and shouldn't be doing, but the poorer neighborhoods are the ones that suffered. So, we do need to look for our individuals that may not be able to follow the guidelines. Maybe they don't understand this as well. And I'm talking more about inner city Atlanta, some of the inner city folks who are just not quite as educated. We need to make darn sure that they're not just saying, hey, it's open season and we can start just freely socializing once again. Now, the reason I think that Sweden failed is pretty apparent from the pictures of what's going on in Sweden. This is right out of the same article, and you can see people eating right next to each other. These are people all sitting outside. They look a little bit distant maybe from each other, but this is not what we need to be doing. I mean, on Friday when things open up, we need to not be, at whatever those businesses are that are open, we cannot be sitting next to each other like this. We shouldn't be doing, sitting in bleachers situation like that either. So I question, is this what they call personal responsibility? I don't know. I don't think so. Okay, the other thing that we need to be sure of is to avoid rebound. So lessons from places that did extremely well: Hong Kong, Taiwan, and Singapore. These are places that really kept things in check. And these are a number of cases. These are cases, the yellow is cases from travel, and the below are local cases that occurred. But Hong Kong, Taiwan, and Singapore were all very, very careful for a while. And then right when they relaxed their restriction, they saw a great increase in the number of COVID cases. A lot of these cases were from people who had traveled abroad. And a large numbers of the clusters were actually dorms for migrant workers. So they weren't very careful about social and physical distancing in these cities when they opened back up. So we definitely do not want these things to happen. We want to be doing the careful things that we're still doing today when we're out at the grocery store, the places that are open. We need to be acting like that in all the places we're going. We need to keep the curve flat. Why? Remember Philadelphia, where they had the big flu, when flu epidemic was going on in 1918 and they had the big war parade. We remember New Orleans. We can't have Mardi Gras, and we can't have what's going on in New York. These are not things that we should be doing or thinking about at all in the next several weeks. Okay. So what do we know about keeping the curve flat? We do know that close quarters lead to rapid infections, and we have a number of examples of that. Why did New Orleans, why did New York, why were these cities the problem? It's because they had large gatherings and coronavirus spread very fast. We do know that the Princess Cruise Line, the first cruise line where that huge outbreak of COVID cases happened, led to a 19% incidence rate. Nursing homes, oh my goodness, we need to be very careful of our elderly population. This is from Connecticut. State nursing homes have COVID infections, some as high as 61%, and 1 out of every 12 nursing home residents has tested positive for COVID. So things spread very fast there. In Detroit, COVID infection rate, 26%. Of the deaths of coronavirus, we know that 20% are attributable directly to nursing homes. So we need to absolutely keep nursing homes locked down. I don't think anyone is suggesting that that's part of this lifting of of the quarantine. But anyone who has older. The other point of this is anyone who has older relatives. You need to be very, very careful. You need to really think about, do I want to be out, exposing myself to, coronavirus if I bring it back to, my 70 or 80-year-old father or grandfather or whatnot. And this is actually CDC direction, is the CDC is actually saying, look, you need to really be careful and lock down nursing homes. Prisons, also extremely high risk. So this is from the Bledsoe County, Tennessee prison. They have about 2,500 inmates there. They looked at 424 inmates. 162 or 38% were positive. So again, the point is when people are in close quarters, it can lead to rapid infections. Now, how many people in the United States have been exposed to COVID? There's this idea that, 80%, 50%, all these people have been exposed to COVID. Well, in general populations, that's probably not accurate. It's probably much less than that. In the two kind of large studies that we've seen, this is out of Stanford and Santa Clara, they looked at just a sampling of the population. And it looks like in Santa Clara, it was about 2.5 to 4%. So 95% or more, 96% of people in at least this community had not been exposed to COVID. So the problem is there's a lot of people out there who are potential spread. And if 96% of the people have it or don't have it, that is a very big potential problem. Now, the other interesting thing was, we hear this, it's 50, 85% or 85-fold more likely or more common than we had previously thought. Well, that's true, but it's still a very, very low number. Similar results in Los Angeles. It was released, I think it was earlier yesterday. About 4.1% of the Los Angeles population have it. And kind of the scary thing about this is a lot of these people and a lot of these prison folks are all asymptomatic. So it's not like you can go to the grocery store and say, hey, all these people look pretty safe. I think I'm good here. There are a lot of those people could very well have COVID and we just flat wouldn't know. Again, though, the numbers are low, 2 to 4%, but it's kind of like, anyone with a certain significant illness, you can't really tell if that person has it just by looking at them, because there's probably a lot of asymptomatic carriers there relative to the overall prevalence of COVID. The last one was, New York OB. It was interesting, New York, where you think there's a heck of a lot of, COVID, it's probably the worst city. They looked at just OB patients, so women coming in to deliver, babies and, who are healthy and didn't have symptoms. 33 out of 215 actually tested positive for COVID. But again, in New York City, where you think there's a heck of a lot of COVID going on, it's only 15% of at least one sample of the population that had it, meaning that 85% of them had not had it. So here's another kind of scary thing. People can shed virus for a long period of time. So this is from New England Medicine Journal Watch. And it says for patients with severe disease, the duration of virus in respiratory samples was 21 days. But for those with mild disease, people that didn't really have much COVID or recovered well, they were able to shed this virus for 14 days. So again, one more reason, very transmissible, is there's just a high window of likely infectivity time. Again, why do we need to keep the curve flat? This is Philadelphia from 1918. This was St. Louis, where they kept the curve flat. They had a 2 times higher death rate here in Philadelphia versus St. Louis. And why is that? Well, the problem is if you overwhelm the medical system, then it becomes difficult to take care of patients. This is an emergency department in New York. And these are all obviously all the workers, the nurses and physicians. And they're wearing hats, they're wearing masks, they're all wearing PPE, there's gloves everywhere. In between every patient that may have COVID, they're having to take this off, they're having to put all this stuff back on. And it takes time to do that, and it takes time to do that in a correct manner. This is what an ER looks like during COVID. This is Mount Sinai Emergency Department in New York, and there's a stretcher with a patient here. There's stretchers here. These are the patient rooms out here. But you could barely walk through the ER here. Now, I know a lot of us have been to the ER when it's busy and, it's Saturday night perhaps, and, it takes several hours to get back. Well, that's going to be every day if we overwhelm the medical system. If somebody comes in here with a heart attack, it becomes very difficult, to mobilize just with the physical limitations here of what's going on. in addition to just all these other folks here. So, I mean, this is what hospitals look like when they get overwhelmed, and we cannot allow that to happen. What else has happened? Well, in places where things get overwhelmed, what have we seen? We've seen increased out-of-hospital cardiac arrest in Detroit, up 275%. New York City, up 471%. And what does that mean? Those are people, and actually I think in Detroit, this was actually related to death calls. In New York City, that's what they call them. So like when an EMS unit is called out to a house and then someone has just already passed away, that's what these are. And these are incredible. And why is that happening? It's because people delay care because they're scared. They're scared to go to a busy emergency department. They're unable to access care because the medical system's been overwhelmed. And then, of course, that's just an overwhelmed system. So these are reasons that we need to keep the curve flat. So if we start to see in any community, in Georgia, for example, we start to see the medical system getting overwhelmed, we need to ratchet it back and go back to where we're at. So that we need to be ready for this if that occurs. Okay, so continue physical distancing, very important part of the end game, and we need to watch and be very careful about increased number of cases. Secondly, we need to continue testing of drugs that may work, including vaccines. And we're not really, we didn't really understand which drugs may work and what doesn't work. But right now, there's no great drug here on the horizon. We're testing certain things, but it turns out that most of these things, just like what they found in China, there's no wonder drug out there. And then vaccines as well. We need to continue development of vaccines because this is what's going to help us develop, it's just another way of developing herd immunity. It's like chickenpox. Either you get it or you get a shot against it. But vaccines is kind of a way to accelerate herd immunity. So vaccines, we know that this is a very lengthy process. We know that this takes years. The fastest you can do it is probably about 8 months, we've heard, and that's kind of an optimistic scenario. And why is that? Because there's this animal testing period. There's this period where you got to do phase 1, phase 2, and phase 3 trials. Then you have to go do all of these number of elements, and this includes going out and inspecting the facility to make sure it's not contaminated and so on. Now, there is that accelerated approval process that we talked about, but even that, the earliest this would be 8 months, and it's probably not going to be here for the fall COVID season. Medications. Like I said, there's no magic medications out there. These are the medicines that we've talked about. These are the ones undergoing large trials right now, hydroxychloroquine, remdesivir, and there's 2 HIV medications. And what recommendations just came out from NIH? They just published recommendations on all of these drugs. And the panel does not recommend any drug for pre or post-exposure prophylaxis, meaning there's no medicines right now that work if you may have been exposed to it. It does not make a recommendation for any specific antiviral drug, as no drug has proven to be safe and effective. And specifically, it's come out against the use of hydroxychloroquine plus zithromax or zithromycin outside of clinical trials because of toxicity risk. And in fact, just yesterday, the study was actually completed several days ago in the VA, but it showed that hydroxychloroquine increases overall mortality and highlight the importance of awaiting the results of ongoing prospective randomized controlled studies before widespread adoption of these drugs. So, we all remember a month ago, everyone was touting that we should be using hydroxychloroquine for everybody. Let's throw everything but the kitchen sink at this. Let's use this and that and the other. And they started finding that these medications lead to worse outcomes than improved outcomes. So again, just another, idea or point that we need to be careful about how we move forward. It's not, being the brazen approach is not always the correct approach. So convalescent plasma has been shown to be helpful, and that's when you take antibodies from people that recover and you inject them into patients that have had COVID. So this is a therapy that we do believe helps. So the point with medicines is most drugs are not recommended. There is some thought that actually one of them, remdesivir, may work, but that's only for hospitalized patients. It's not for outpatients like you and me that may catch it here on the street and have a mild case of COVID. And to remdesivir is not for to try to prevent that from getting. It's not like a Z-Pack that we can take for a sinus infection to kind of stave off getting worse, right? This is only for hospitalized patients. And again, convalescent plasma is for hospitalized patients as well. This is kind of a reminder, just kind of be careful who you listen to. And I talked about that last week. So my point here in the testing of drugs and vaccines, it's kind of run its course. I don't think that waiting any longer for some drug to come out or for a vaccine to come out, that's not a reason right now that we should delay kind of moving things along with ending the stay-at-home orders. Now, one thing that does make sense to me is waiting on rapid testing. And there's two types of rapid tests. Number one is the antibody blood test, and that's a blood test. This is looking for IgG and IgM. That's the antibody test. And what that does is that shows who's had the disease in the past. This is a PCR swab, and this shows who has the disease now. So if I have COVID symptoms and I don't feel good and I go to the ER because I'm worried I may have COVID, or I go see a doctor and I'm worried about my breathing, and to test whether I have COVID or not, they're going to do a nasal swab. And this is going to be about 60 to 70% accurate in picking up whether I have COVID or not. This antibody test is too early. We're not going to see antibodies in someone who's acutely ill for several days anyway after they develop the illness. This test over here is to kind of see how many people in the population have been exposed and how many people have had it. They both have their role. In the emergency department, this is the test we're looking for to see if we've seen 10 people today who may have COVID, we would be picking up about 7 of the 10. Now, the reality is we don't have this test. It would be awesome if we had this test, because just like a flu test, we could tell, to 60 to 70% accuracy who's had the disease, who has the disease. But we don't have enough tests right now. We can only test people that are admitted to the hospital. And on a community standpoint, we don't have enough of these tests to do community-wide testing. Similar, who's had the disease, this antibody blood test is not readily available. Now, it turns out there are certain medical systems, Emory is one of them, where they're doing widespread testing on folks who are employees there. And why is that important? It's important for a couple reasons. One is to know kind of what's the prevalence in healthcare workers. It's also to help protect people. And third, it's also to help give an understanding of how many people in the community may have it. So we may have a lot of information based on this test. But these tests, again, are not, they're coming online. We keep hearing that this PCR nasal swab is going to be available, but it's simply not out there widespread yet. Okay, so end game, we also need to slow the release of healthy back to the population. And I think that's what Georgia's plan does, is says, look, it's okay for you to go to these places, but we need to be smart as individuals, and we need to not just go back to our old daily routine. We can't be doing group bike rides. We shouldn't be, doing, workouts in close proximity at the gym with a bunch of people right next to each other. We need to do things slowly. We need to maintain our physical distancing, and need to not be shaking hands. We need to be doing everything we're doing right now, but just in a few more places than we were previously under the quarantine. Then what I said was we need to retest. So periodically, every week or two, we need to, again, reassess and say how many people have the disease. And then, and only then, would we start considering releasing the less healthy back into the population? And I don't think this is going to happen for a long time. This is definitely not something we should be doing until we have a very good handle on what the situation, what the prevalence is in our given population. So Again, this is the end game. This is what we discussed last week. I want to just kind of talk about or just remind us where I think we're at with each of these things. Physical distancing. I think Georgia's plan does allow for this. I mean, we're not going to be quite as physically distant because we are opening up certain places, but that is clearly part of Governor Kemp's plan. One thing I would add that I didn't hear as part of the plan is I would add, and there are several states that have required this, is required surgical masks in public. That, again, surgical mask does not protect the patient or the person wearing the surgical mask. It protects everybody else. And I see a lot of them at the grocery store and so on, and I congratulate everybody who's doing that. Because remember, this is a droplet spread phenomenon. When people cough, those droplets are landing on things. Shopping carts, the counter when you check out, door handles, and so on. And if people are wearing surgical masks, that's going to be a lot less likely to spread. Continue testing of drugs that may work, including vaccines. Well, we are continuing these things. I mean, it's not part of Governor Kemp's plan, but it's something that we're doing. And I don't think that waiting another month or two is going to give us a more crystal clear picture of any particular drug that's going to make COVID more treatable for those of us that are relatively healthy. And vaccines, again, more than a year away. So I don't think this should be an impediment to us getting back to our daily, or getting back to mainstreaming or ending the quarantine, I should say. Rapid testing, so we're not there yet. We keep hearing that rapid testing is kind of around the corner. We are seeing, again, like at Emory, the antibody test. But the rapid testing, unfortunately, we have ramped it up in the hospitals a little bit, but it's just not mainstream enough to where we can just rapidly identify at least 60 or 70% of the people that have the disease with it. I do think the plan allows for a slow release of healthy back to the population, and really that's going to depend on me and you. We need to still be smart. When Friday hits or next Monday hits, we need to not just be rushing back into doing things the way we used to be doing. We need to be smart. So I hope the message is not that, everything's opened up, I can go do things as usual. We need to have a healthy respect for this disease. Retesting, again, not there. And release the less healthy back into the population is somewhat of a question mark, and similar to releasing the healthy people, those of us who are healthy getting back into the population. I think that's something that we definitely need to watch, and we need to not be exposing. If we are out touching a number of people in the community as citizens, we need to not be around our less healthy population, because remember, we can now be asymptomatic carriers. And again, no way to test, or not very good ways to test right now, whether we have it or not. So we need to be very, very careful of being around our more ginger population. Again, I want to emphasize physical distancing. We need to be doing it. I want to just kind of walk through these things. I've shown this picture many times, but I see so many people, they wear their mask and they just grab for the handle of the shopping cart, or they're opening doors without thinking about the fact that they're touching something. Just poles and other common things we're touching. We need to not be doing that. And we need to not be, petting our neighbor's dog. This is Nova. She's made it into several of these. It's my puppy. She's 7 months old. And we need to remember, this is a horrible disease. I mean, in people that get it, this is horrible. This is what it does to their lungs. This is somebody who's not doing well and probably won't make it. We need to remember that the older, more fragile part of our population, remember this slide from before, the older population, much higher mortality rate. But even people in their 50s, a 1% mortality rate is not a good mortality rate. Medical databases, again, this is middle-aged people. 1 in 10 folks who are middle-aged who get hospitalized won't make it. So remember, it is definitely a disease of older and more fragile, but it can hit any of us. And that's it. I appreciate everyone's time. Hopefully I didn't sound too political. I do think that maybe we're a little bit early on this one, but I'm not going to disagree. I think that if our governor's made a decision, we all need to just move forward together with it, but we need to be smart. I think it's wise for all of us to be wearing masks. I wish that was part of the plan. I don't know about tattoo parlors in some of these places. Maybe they could have been a little bit slower to come online. But I do think with the curves bending, I think if we're all careful and we all pay attention, I think that we will get through this and do okay. So anyway, those are my comments. And I have a couple questions. Just going to kind of come through here. All right, so there's no new ones here. Okay, so someone had a question about, look, if I come to the ER, what should I bring? In other words, when you go to an ER right now, you can't come back. Your family can't come back with you. You're pretty much there by yourself. The exception would be children, where one parent can come back with children, and the reason for that is obvious: is that we don't want any more people that can possibly either contract it or give COVID to somebody else. So the concern was, well, if I go in or my mother goes in and she can't speak for herself, what do they need? And the most important thing is probably a contact phone number. So if you could write on a card a contact phone number and maybe multiple phone numbers when you come to the ER, that's very helpful. The other thing that's just always helpful when you come to an ER is an accurate medicine list with dosages. So I see people come in and there's a kind of a scratched up card and they say, well, I don't take that one anymore, and that one's not quite right, and so on. But an accurate medicine list is always a smart thing to have. And if you can keep it like on your iPhone or something, just kind of a texted list, a written list, that's real helpful. And similar updated allergy list, and then a list of your medical problems or any significant medical problem that the physician would need to know. If you have a little allergies or something, that's not so important. You can list it if you want. Doctors don't like reading, like 2 pages of stuff, because then it just confuses things. But if you have some major medical problems, like you've had a pacemaker, you have had heart valve surgery, or, you're on a blood thinner, I guess that would be in your medicines. That would be real help. Those are always really helpful. Then there was a question on testing, accuracy of testing, and when is testing going to happen. And unfortunately, I'm going to turn this around. Unfortunately, I don't have a great answer for that. I mean, we keep hearing that kind of widespread mainstream testing is around the corner. And now there's all these tests coming out here. I was reading one that was from China, and it had, they looked at like 15 cases or something with this particular test. 15 cases. And they were trying to show that the accuracy of the test was high, but there's a lot of question marks about some of these. But certainly if you go to a legitimate, center like, LabCorp and so on, with a doctor's order, you should be able to get a test, but still, from my understanding, it's still, I should know the answer to this, but I don't, but it's still just very, very cumbersome. I congratulate Emory and any large health system, for doing antibody testing across all of their folks. It doesn't say who has it now, but it indicates who's had it in the past. And if you're part of a large hospital system, it's really good to know that, 20% of our workers have had this, again, just very helpful information from a demographic standpoint so that we can just understand this disease better, because we don't know. We don't know how many people in Alpharetta have it. We don't know how many people in Atlanta have it. We know of hospitalized patients how many people have it, but we don't know. It's like the prison up in Bledsoe. 36% of their inmates have it, of the ones they tested, and they had no idea. So we don't know. We're kind of taking stabs in the dark, and that is one thing that does concern me a little bit about opening up Georgia when we don't really know the numbers. But the fact is, we've been hearing about it for a while. It may be 2 months before we know the numbers. So it does make sense that we should have to wait and get a little bit more, and not wait 2 months or 3 months for something that may not happen, right? So anyway, that's my thoughts on testing. Someone had a question about the virus, about the flu virus. There's a whole thing about, well, geez, it's going to be worse in the fall and so on. And again, I was listening to Trump and Dr. Robert Redfield. He's the CDC director, who was on about an hour ago. And the point is, we don't expect COVID to be worse in the fall. What we're concerned about is that COVID and flu might hit at the same time. And if that happens, from a diagnostic treatment standpoint, and who needs to be, separated from who, all those kind of questions. It's just challenging when you have two illnesses that kind of have some overlap just in caring for them. So the challenge and why it might be worse is some people may actually develop both, confusion about diagnoses in some ways, and so on. So that was kind of the concern with that. Not that COVID is going to get worse. I did have a question about, well, gee, shouldn't we just be free and be able to do whatever we want, and what's the big deal? Why shouldn't I be allowed to, just go do whatever I want? Why do I have to be sequestered at home? And now that starts bordering on a little bit of a political discussion, which I kind of want to stay away from. But I'll give a couple examples. I mean, there's a lot of medical examples why in this country we believe as part of being in society, you need to have done. And one of them is measles vaccine. Measles is highly infectious. You can infect someone with measles from 20 feet away. So if somebody, and we do know that there's been a measles outbreak in the United States, like last year. Measles kills 100,000 people a year in the world, right? So if we should all be protected against that. And our way of doing it is an agreement of being part of a community or a part of the United States is that you will get immunized because you protect everybody else. So it's kind of this, being part of the club, if you will, you need to do certain things. Motorcycle helmets would be another one is, people need to wear motorcycle helmets because if they get in an accident and they aren't wearing a helmet, then they take lots and lots of medical resources, which divert those medical resources from other people. So that's kind of another thing that I think we give up being part of society. So another thing is, if COVID comes back and it's ravaging our medical system and overwhelming our ability to take care of people, we may need to go back to a quarantine, or home lockdown situation. And I think we all need to be ready for that. What else? I think that's it. Let's see, any other questions here? Good comment. I feel like we're putting a lot of trust in John Q. Public to be smart about this disease and listen to recommendations. I mean, that's my fear too. I mean, that's just an excellent point. There's a state, I don't know if it's Connecticut, I can't remember which state it was, but essentially people were required to wear masks. And I don't think that would be a bad requirement at all. And, at least that would indicate that if people weren't wearing the mask, that, hey, they're definitely not following the recommendations. I mean, right now, too, I see people wearing their mask, and another comment is, they're always doing this, and they're adjusting their mask, and they're putting their mask down to talk, or they're, I don't know what they're doing. But the fact, if you're wearing a mask, you need to not be touching the mask. I mean, because if you're bringing your hands near your face, that's kind of one of the things that the mask is supposed to do, is tell you not to keep your hands near your face. But anyway, I diverted from that question a little bit. I don't know. If I knew how to do that poll thing on Facebook, I would certainly do the poll thing, because I'd be the poll, POLL, not a pole dance, but the poll thing. Because I'd like to know what people think about that. Do people think that we should be locking everybody down just to protect people from their own selves, or not? I don't know. I mean, the other thing too is the fact that people are not out there being careful about what they're doing, they're potentially infecting other people. And, I just don't have a great answer on that. But I do know or feel that waiting a month or two for all of this to kind of shake out, I just don't feel like a lot is going to shake out in that time period. And I think that if we do this slowly and we do it responsibly, I think we'll be okay. And hopefully, if people are doing things that are irresponsible out there, I hope that we as citizens, if somebody calls me out because I'm not social distancing properly or whatever, I'd like to think that we just don't snipe at each other and we get through this together. I know when you get shushed or something, our first impression is just to, tell people off. But this is real important, and I hope we kind of put the kind of our differences aside, or maybe I shouldn't say that. We should just work together collegially to just do the right thing. But Governor Kemp, I hope you made the right decision. I will be in support of it because, you're our governor, and I want to think that the people of Georgia do the right thing, and that we put this behind us, and that, we show a great example. We're the first state, right? I hope we show a great example for the rest of the country about Georgia did a good job. All right, I appreciate everybody listening. I'm going to save this. It'll be on my Facebook page. Hopefully I didn't offend anybody. I'll try to answer as many questions as I can in the time I have. Appreciate everyone's time. Thanks.